Thank you for listening to this video about metabolic syndrome. This video will provide you an overview of the disease, prevalence, risk factors, and ways to prevent metabolic syndrome. I hope by the end of the video, you will be able to discuss metabolic syndrome and its impact on overall health. You can also develop plans for healthy lifestyles to treat and prevent the disease. Metabolic syndrome is a growing public health concern. It affects approximately 1/3 of Americans. Its prevalence increases significantly with age. So what is metabolic syndrome? The word metabolic refers to biochemical process involved in the body's normal functioning. The word syndrome refers to the patterns of symptoms when together are characteristics of a specific disorder or disease. When you put these two words together, metabolic syndrome is a cluster of conditions that increases your risk for complications such as heart disease, stroke, and type 2 diabetes. Who is at risk for metabolic syndrome? People have at least 3 of the following conditions. Central obesity, men with waist greater than 40 inches, women with waist greater than 35 inches. Triglyceride greater than 150 milligram per deciliter. Good cholesterol, HDL, less than 40 in male and less than 50 in female. Hypertension, with the systolic blood pressure greater than 130 and diastolic greater than 85. Fasting blood sugar greater than 100 milligram per deciliter. While having one of these conditions does not always mean you have metabolic syndrome. Developing more of these conditions often leads to an increased risk of complication. According to Heart, Lung, Blood Institute, a person with metabolic syndrome is twice as likely to develop heart disease and 5 times as likely to develop diabetes as someone without metabolic syndrome. Other risk factors for metabolic syndrome include age. Approximately 40% of those older than 60 years old are at risk for metabolic syndrome. And when they are older than 70 years old, the risk is increased to 63%. Race is another risk factor. Mexican Americans are at highest risks. So if they are between the age of 30 and 47 years old, the prevalence is about 26%. Obesity is another risk factor, diabetes, and other conditions like inflammatory disease and physical inactivities and smoking. So when to seek for medical advice? If you have at least one risk factor, you may have others, but you may not know that you have it. So it's important to discuss your concern with your doctor. What are the treatments of metabolic syndromes? Exercise is one of the important treatment of the disease. 30 to 60 minutes of moderate intensity exercise every day, such as walking very briskly, like 4 miles per hour, bicycling, or simple tasks that you do at home, like cleaning, mowing lawns, also part of exercise. Healthy diets with balanced diet, reduce calories, reduce saturated fats in your diet, also increase fruits and veggies in your diet. So the next will be making healthy choices, like avoid smoking, help to manage stress, and also routine doctor visits, also important for treating this condition. If lifestyle changes do not work, medications may be prescribed, like blood pressure medication, high cholesterol medication, diabetes, and weight loss. So these are, as we talked earlier, are one of the risk factors that put you at risk for metabolic syndromes. And it's important to manage these individual disease so that you will decrease your risk for metabolic syndrome. In summary, the number of people with metabolic syndrome continue to rise. Metabolic syndrome may soon become the leading risk factor for heart disease, stroke, and type 2 diabetes. It is important that you take action today to prevent and treat the disease, and also teach your families, relatives about the disease so that they can also benefit from the video today. Thank you for your time.